What if your heart stopped for 5 minutes, then restarted? Imagine an ordinary moment. You're not running. You're not afraid. You're not even thinking about your heart. And then without warning, your heart stops beating. Not slowly, not irregularly. It stops. There is no dramatic sensation in your chest. No pain. No internal alarm screaming for attention. What actually happens is quieter than most people expect. Blood stops moving through your body. Oxygen delivery to your brain ends instantly. Every cell that depends on that constant flow suddenly finds itself cut off. Within seconds, consciousness slips away, not because you are dead, but because the brain cannot remain awake without oxygen. 5 minutes later, something extraordinary happens. Your heart begins to beat again. This raises a question most people have never considered carefully. When the heart restarts, does life simply continue, or does the body return changed? To answer that, we need to move slowly, second by second, through what truly happens inside the human body. Part 1. The first seconds without a heartbeat. The heart's role is simple, but absolute. It moves oxygen, nutrients, and energy to every organ. When it stops, that supply chain collapses immediately. Within 5 to 10 seconds, blood pressure drops to zero. The brain, which consumes more oxygen than any other organ, is the first to react. Electrical activity in the brain begins to slow. Vision narrows. Sound fades. At around 10 to 15 seconds, consciousness is lost. This loss is not violent or painful. It is more like falling asleep, except this sleep is caused by deprivation, not rest. At this point, the body is not dead. Cells are still intact, but survival has entered a countdown. Part 2. 30 seconds to 1 minute. By the 30-second mark, the brain switches into emergency mode. Normal energy production stops. Cells begin relying on inefficient backup systems. Waste products, normally flushed away by blood flow, begin to accumulate. Electrical signals in the brain become unstable. This instability explains why some people who are later revived report flashes of light, distorted sounds, feelings of floating or detachment. These experiences are not supernatural events. They are the brain misfiring as it struggles to maintain order. At 1 full minute, damage has still not fully occurred, but the margin for recovery is shrinking. The brain is surviving, but only just. Part 3. 2 to 3 minutes. After 2 minutes without oxygen, the situation becomes serious. Brain cells begin to swell. Chemical balances inside neurons collapse. Communication between regions of the brain breaks down. Doctors describe this phase as potentially reversible injury. That phrase is important. It means some cells may recover if oxygen returns soon, but others may not. During this time, memory-forming regions become vulnerable. Attention and awareness are impossible. The brain operates only on survival chemistry. The person is unconscious, but the body is not passive. Every remaining resource is being used to delay damage. Part 4. 4 to 5 minutes, the critical threshold. Between the 4th and 5th minute, the body reaches a turning point. At 4 minutes, the risk of permanent brain injury rises sharply. At 5 minutes, widespread neuronal death begins. The brain areas affected first are not movement centers, but the subtle systems that define who we are. These include memory, emotional regulation, focus and judgment, personality traits. This is why survival does not always mean full recovery. Even if the heart restarts now, some damage may already be irreversible. But if circulation returns at this moment, life is still possible. Part 5. The heart restarts. When the heart begins beating again, blood surges back into the brain. Oxygen floods tissues that were starved for minutes. This sudden return is life-saving, but it is not harmless. The process triggers inflammation. Free radicals form. Cells weakened by oxygen deprivation may be injured further. This is known as reperfusion injury. For this reason, survival after cardiac arrest is carefully managed. Doctors control oxygen levels, blood pressure, body temperature. Restarting the heart is not the end of the crisis. It is the beginning of recovery. Part 6. The first hours after revival. In the hours that follow, outcomes vary widely. Some people wake up confused. Others wake up emotional or disoriented. Some remain unconscious for hours or days. Common early effects include memory gaps, difficulty speaking, weakness, altered emotional responses. The brain is reorganizing itself, repairing what it can, compensating for what it cannot, like a system reboot after a sudden power loss. Not every function returns perfectly. Part 7. Long-term changes. Weeks or months later, subtle changes may remain. Some survivors notice reduced concentration, personality shifts, increased anxiety or depression, changes in emotional intensity. Interestingly, many also report a deeper appreciation for life, altered priorities, reduced fear of death. Science can explain the physical changes in the brain, but personal meaning varies from one survivor to another. Conclusion: what 5 minutes can change? So what if your heart stopped for 5 minutes and then restarted? You might survive, you might recover, but you would not pass through unchanged. 5 minutes without a heartbeat is not a pause. It is a test of how much the brain and the person can endure. The heart may restart, but the experience leaves its imprint, and that is what makes the human body both fragile and remarkable. If 5 minutes can change a life forever, what do you think happens in 10 or 30? Subscribe for more deep dives into the hidden limits of the human body, and tell us in the comments what surprised you the most.